கொலாப்ஸ் ஆனால் எப்படியாச்சும் ஐடி டீம் வந்து ரெஸ்டோர் பண்ணிடுறாங்க இல்லையா, டெஸ்க்டாப் கிராஷ் ஆச்சு இல்லாட்டி இன்டர்நெட் கிராஷ் ஆச்சுன்னா அந்த மாதிரி தே ஆர் ஆல்சோ நமக்கு கார்டியாக் அரெஸ்ட்லேருந்து ரிவைவ் பண்ணுறதுக்கு எப்படி எக்ஸ்பீரியன்ஸ் இருக்கோ அவங்களுக்கும் ஐடி ரிலேட்டட் ப்ராப்ளம்ஸ் வந்தால் எப்படி சால்வ் பண்ணுறதுங்கிற ப்ராக்டிஸ் இருக்கிறதுனால less than 4 hours notice they have put together another team. So first of all, thank you and a big round of applause for IT team for continuing to do the program, though the main person is we wish Mr. Pichimani quick recovery, and we shall show him the recording to tell him what he missed. So இப்போ எல்லாரும் யாரெல்லாம் அந்த ஐடி டிபார்ட்மெண்ட்டோட ஏதாவது எனி கொலாபரேஷன் வச்சிருக்கீங்க? புட் அப் யுவர் ஹேண்ட்ஸ். இங்க இருக்கிற நர்சஸ் யாருக்குமே ஐடி டிபார்ட்மெண்ட்ல சம்பந்தமே கிடையாதா? கால் பண்றது இல்ல, டெய்லி சிஸ்டம் யூஸ் பண்றீங்களா இல்லையா? எவ்ரிதிங் யூ ஆர் யூசிங் த சிஸ்டம், ரைட்? அண்ட் அந்த சிஸ்டம் யூஸ் பண்றதுனால சில பெனிஃபிட்ஸும் இருக்கு, சில தலைவலியும் இருக்கு இல்லையா? ஸோ அந்த பெனிஃபிட் எப்படி அவங்க லைஃப்பை கொஞ்சம் ஈஸி பண்ணலாம், அண்ட் நீங்கள் ஆல்ரெடி யூஸ் பண்ணுறது தவிர வேறு எதுக்கெல்லாம் அந்த ஐடி கேன் சப்போர்ட் அப்படிங்கிறது சொல்கிறதுக்கு தான் இன்றைக்கி வந்திருக்காங்க. ஸோ ஐ ஹேண்ட் ஓவர் த லீட் டு மிஸ்டர் சதீஷ். ஹீஸ் கம் ஆல் த வே ஃப்ரம் மெயின் எம்ஜிஎம் டு ட்ரபிள் ஷூட் டுடே.
Thank you, Doctor. So good afternoon, everyone. So my name is Satish Kumar. So I am heading the IT of the entire MGM group. Today our agenda is we can segregate into 4 kind of details. So, number 1 is we can talk about the security of data and other stuff, and how we are improving the patient experience through our IT systems. And we can talk about the IT organization structure, so how we are structuring it. And we have a couple of role plays. That one, we can talk about the awareness, how we can provide awareness to the nursing desk and other peoples. And number 2 is the real scenario, how we are utilizing the EMR and data capitalization and other stuff. So this is how we are structuring the today's agenda. So let us focus on the agenda, and you can after that definitely we can have a Q&A sessions. Idhula edha doubt irukku appadina you can intermediately you can ask questions. We are open to the questions, anything. I am introducing my team. So Mr. Murthy, so he is a senior infrastructure manager. He was a previous and past Malar Hospital. He only handling all the infrastructures. So he was worked in Malar is more than 5 years, I guess. Correct, na? So and then Vishali, she is handling the application support. And Sukumar, Melkin and Gurumurthy. So இவங்க 3 பேரும் உங்களுக்கு நல்லா தெரியும் நினைக்கிறேன். ஸோ இந்த மேடம் சொன்ன மாதிரி we are calling daily to IT team. ஆக்சுவலாக வந்து கால் பண்ணாமல் நான் எப்படி ஹெல்ப் டெஸ்க் சிஸ்டம் யூஸ் பண்ணுறது நம்ம பார்க்கணும். நம்பர் 1, ஏன்னா டிஜிட்டலைசேஷன் பண்ணணும். நீங்கள் டெய்லி உனக்கு ஒரு 10 ப்ராப்ளம் வருது அப்படின்னா அந்த 10 ப்ராப்ளத்தை நம்ம எப்படி கம்மி பண்ணலாம், தட் இஸ் தி அஜெண்டா ஆஃப் திஸ் டிஸ்கஷனாக இருக்கணும் அப்படிங்கிறது என்னுடைய திங்கிங். So with that note, I am moving to hand over the entire session to our team members. Definitely our team members will help you, and you can ask any questions intermediately. I will answer it. Thank you so much.
Good afternoon all. So today we are talking about our healthcare IT, how it is working. So introduction about our IT healthcare in the information technology we used to help to you people to address our day-to-day activities about our HIS and system desktop printers. So you know very well. So increasing the complexity of patient care, rising the intensity of quality service, it plays official roles transferring healthcare delivery. So objectives of IT in healthcare. So இதை நம்ம 3 விதமாக பிரித்து பார்க்கலாம். ஸோ ஃபர்ஸ்ட் ஒன் இஸ் என்ஹான்ஸ் பேஷண்ட் கேர் குவாலிட்டி அண்ட் என்ஷூர் தி டேட்டா செக்யூரிட்டி ஆஃப் privacy and improve our operational efficiency. So electronic health record systems to provide accurate and updated patient information. Normally we used to HIS in cranium, we are updating this type of records. And data security, cybersecurity measures to protect patient data under regulations such as in HIPAA compliance. So audit level சொல்லுவாங்க HIPAA compliance like JCI, NABH. So என்ன digitization IT security level இருக்கோ அதை நம்ம வந்து compulsory we used to meet our requirements and improve our operational efficiency. Automation administrative process like patient registration and appointment scheduling. So nowadays automated நம்ம appointment schedule பண்ணிருக்கோம் craniumல. So அந்த objective motivated இந்த operational efficiency it will work. Integrity of various hospital systems like in EHR, PACS, LIS, seamless data flow வரதுக்கு we need to improve our operational efficiency. So enable the telemedicine systems in the remote care. So deploy system that support virtual consultation, remote monitoring and mobile health apps. Ensure reliability and usability of telehealth platforms. So normally we used to do telemedicine systems in our organization. So prepare IT infrastructure for periodic audits and certifications. So this இதெல்லாம் வந்து HCல பண்ணிருக்கோம். So same like that we need to implement in ADR Malar also. So digital initiative பார்த்தீங்கன்னா live revenue dashboard and self registration kiosk and reduce the queueல நிக்கிறதுக்கு பதிலா நம்ம செல்ஃபா கியாஸ்க் மிஷின் போட்டோம்னா பேஷண்ட்டே வந்து அட்டெண்ட் பண்ணிட்டு அவங்களோட இது வந்து அப்ஜெக்டிவ் என்டர் பண்ணிட்டோம்னா டேட்டா ஃப்ளோ வந்து அவங்களுக்கு வந்துடும். ஸோ அந்த இஷ்யூ இம்ப்ளிமெண்ட் பண்ணியிருக்கோம் ஹெல்த் கேரில். ஸோ சேம் லைக் தட் வி நீட் இம்ப்ளிமெண்ட் இன் மலர் ஆல்சோ. ஸோ ஒன் ஆஃப் த திங் இஸ் கியூ மேனேஜ்மெண்ட் சிஸ்டம். ஸோ ரியல் டைம் டோக்கன் சிஸ்டம் ஓபியில் எடுத்துக்கலாம் அண்ட் அவங்களோட எக்ஸ்பீரியன்ஸ் வந்து அந்த ஷேர் பண்ணிக்கலாம் அவங்களோடது. ஸோ ஆர்கனைசேஷன் ஸ்ட்ரக்சர் பார்த்தீங்கன்னா நம்மளோட டிபார்ட்மெண்ட் இப்படி தான் இருக்கும். ஸோ யூஸ்டு டு அண்டர் IT8, ஸோ வி 3 people அண்டர் டீம் லீட் பண்ணுவோம். ஸோ ஆஃப்டர் தட் அப்ளிகேஷன் டீம் வருவாங்க அண்ட் தட் IT சப்போர்ட் வரும். ஸோ சென்ட்ரலாக ஹெல்ப் டெஸ்க் இருக்கும். ஸோ இதில் வந்து நமக்கு ப்ராப்ளம்ஸ் ஏதாவது இருக்குது அப்படின்னம்னா த்ரூ டிக்கெட்டிங் சிஸ்டம் வழியாக நம்ம யூஸ் டு லாக் த டிக்கெட்ஸ். So 3 pillars of IT healthcare in one is patient experience, another is doctor user experience and IT compliance. This is the core of IT strategy. First, patient experience. So health records via patient portals, online appointment scheduling, bill payments and lab results, virtual consultation, telemedicine platforms. So transparency in the care. So these are the experience we are facing right now. Second one is doctors and clinical user experience. So user friendly user interfaces and documentations. So how we are recording the patient details in the HIS, reduce the administration workload and referral and alerts. Third pillar is IT compliance. So we used to data protect as per our regulatory authorities like HIPAA and GDRR and local regularities. So role-based access we need to provide for secure login mechanisms to protect our data. So end-to-end encryption should be there to regulatory vulnerability assessment. Also a periodic audit should need to be established. So incident reports rise பண்ணோம். As per policy enforcement, it should be adopted. So periodic regular training should be there. Also data privacy, and as per it should meet our cybersecurity policies. So value delivered. So doctors, so we are used to give fast access and reduced admin work, those related in HIS. So it should work in the EMR. Nurses, easy documentation and timely alerts. So all the things it's captured in the HIS. In main HC we have implemented the QMS. So people can easily adopt their past access and via QMS. Their IPM are also implemented. So something about application, Vishali will tell the flows.
Hi, I'm Vishali, handling application. So here I'm attached one image. No, this is what we implemented in our HC. Okay, so soon we are planned to implement in CA across all locations in Malar as well in Vizag. So this is our plan. For QMS we implemented like in future token system also we are going to implement. As of now you can able to change the doctor's name. We are mentioning room change, doctor change. In tab itself we can able to change the doctors. In room which doctor is there, no, we can able to change in tab itself, in touch. So we are planning to implement it in our future project. As of now we implemented in our HC. Kiosk as well. Kiosk is only for registration come appointment. In future lab results also patients can able to take as well radiology and everything we are going to implement in future planning. So as of now in HC patient can able to register their details like self registration. After that they can able to book the appointment whichever we are integrated in like we created appointment in HIS. So that HIS slots will means the timing and doctor's name will reflect there. They can able to book the appointment. For future also if doctor recommends some after 1 week they have to follow ups and all, they can able to book the appointment in kiosk itself. That is the main motto. And for patient it is very easy. They are at least we got an appointment around day 15 or 16 appointments through kiosk. We are implemented QR also for this kiosk appointment. So these are the upcoming project as I said. So expand kiosk to all branches, and now we are in testing for mobile apps. Its name is Connect app. So MGM Connect app, it is both two apps are there which is going to implement. Like one is doctor app, one is patient app. Patient can able to view all the OP records and IP records which all are entered in our cranium. They can able to view from mobile itself. With their mobile login, they will get one OTP. So like that, doctor also they will log in with their mobile number. They will get OTP because which number is registered. No, that number only they can able to log in that mobile. None of them will log in. They can able to view their records from their mobile itself. Okay. So this is our future projects and mobile tools for real-time approvals, and as I said, QMS and tab for check-in from check-in to discharge. They can able to from check-in to check-out. And this is a paperless operations. Now we are using here DocSphere, but it is not fully integrated with our cranium. So it is 50-50 is there. So our motto is like to implement it is in cranium itself. EMR doctors need to use in cranium. Then you can able to view the all records in future also from cranium. I will show after these things how it will the past history they can able to view. Because in DocSphere you have a documentation, but it is not in cranium. I don't know how it will gonna work. Yes. So next, cybersecurity, it's full data protection, so I will explain.
So cybersecurity part, so user should change the password periodically to access their mail and system login. Wherever they are using credential, there should be changed periodically. They put some strong password. So it should contain with special characters and upper lower cases. It should be in 12 characters or something. So periodically for every 45 days should be changed. Also, if you have in your laptop, you should install your antivirus. That virus pattern should be in up to date. So normally if you used to Symantec or K7 and McAfee, so whichever antivirus you are using, that virus pattern will update automatically. So we ensure to check that those the things. So up to date software update patches is there or not. Also, if you are using the operating system, there check for Windows update option will be there. So latest patches it will get, if you are connected in the internet, it will download automatically. So what are the things in the virus pattern they released, those patches they will release and it will automatically update. Backups. So if you are saving some document in desktop or documents, so it will automatically ping into the OneDrive. If you are in the MGM account, we used to give some 1 TB storage. So it will automatically synchronization will happen. So we need to ensure all the data is up to date. Firewall and antivirus, those things in the back end. So we used to give for role-based access to all the users. So which user need give USB access, which user to install admin privileges. So based on user access level, we will periodically review and we will give. And training and monitoring. Training and monitoring, necessary training we are giving for all the HAs related users, as well as for awareness system users, we are communicating for every month for some initiatives. So those kind of security levels we are taking, and users should meet their ASPERS policies. So anything?
ஆக்சுவலாக வந்து என் டீம் பேசினதில் வந்து நிறைய பேருக்கு புரிஞ்சிருக்காது, ஏன்னா தே ஆர் டூ டெக்னிக்கலாக வந்து பேசினாங்கன்னு நான் நினைக்கிறேன். ஸோ ஐ வாண்ட் டு டிஸ்கஸ் வித் யூ ரிகார்டிங் பேஷண்ட் எக்ஸ்பீரியன்ஸ். ஓகே, இப்போ வந்து ஒரு பேஷண்ட் உள்ள வராங்க அப்படின்னா ஹவு ஐடி வில் இன்ட்ராக்ட் வித் த பேஷண்ட், how we will increase the patient experience. Take an example, one patient is coming inside to the hospital as in a first visit. What they will do? First they want to do the registration, right? In the registration point of view, enna pannalam appdi nama think பண்ணும்போது what we thought about is we want to create a self registration process, right? And the self registration process we are having as in a QR code. The patient can go directly and scan the QR code and register it themselves. Or number 2, we have a kiosk based process where patient directly go to the kiosk, they can do the process. இதுதான் வந்து ஃபர்ஸ்ட் வந்து பேஷண்ட்டை வந்து நாங்கள் அப்ரோச் பண்ணுறதுக்கான ஃபர்ஸ்ட் ஐடி பாயிண்ட் ஆஃப் கான்டாக்ட். அது முடிஞ்சதுக்கு அப்புறமா நெக்ஸ்ட் என்ன பண்ணுவாங்க, பேஷண்ட் தே வில் கோ ஃபார் தி கியூ மேனேஜ்மெண்ட் ப்ராசஸ் இருக்கணும். For an example, Dr. X இவர் வந்து ரூம் நம்பர் ஓபிடி நம்பர் 202 இருக்காரு அப்படின்னா we want to inform them 202 இங்க இருக்கு, doctor is available or not, who is the next patient, what number you are, I mean என்ன நம்பர்ல நீங்க இருக்கீங்க அப்படிங்கிற information we need to give it to the patient. That we have implemented one logic that is already available in the HC, right? That is also we need to deploy it in Malar as soon as possible. இது வந்து second touch point. Third touch point, patient directly will go to doctors and doctors will start the consultation. Currently we are working with DocSper, we are not working with Cranium, we are silo, right? Silo in the sense whatever the data and whatever the doctor notes you are typing it in DocSper, and the patient ke theriyadu நம்ம ஏதாவது கொடுக்குறோமா, ஏதாவது டிஜிட்டலாக ஏதாவது கொடுக்குறோமா, we don't have anything right now. We are hand over the paper to them. அந்த பேப்பர் இன்னைக்கு இருக்கும், நாளைக்கு இருக்கும், நாளைக்கு எங்க போகுதுன்னு யாருக்குமே தெரியாது. So there is no digital point of view as of now. We don't have anything that we need to bring up on the table. அதை எப்படி கொண்டு வரலாம்? So we have a concept called EMR concept. So EMR மட்டும் கொடுத்துட்டா டாக்டர் ஓகேவா? No. Doctor cannot write or type in front of system while discussing with the patient. அதை நம்ம எப்படி கொண்டு வருது? So we need to give a voice to text. அந்த வாட்ச் டு டெக்ஸ்ட்டுக்கு தான் ஆக்னிட்டோ லைசன்ஸ் நம்ம வந்து ப்ரொக்யூர் பண்ணிடுவோம். ஸோ அந்த ஆக்னிட்டோ லைசன்ஸை வந்து டாக்டருக்கு போட்டு நாம வந்து அவங்களுடைய பேஷண்ட் கிட்ட பேசும்போது whatever the things they have to capture it as in a digitalized format, they can capture it. அந்த டீடைல்ஸ் வந்துட்டு நெக்ஸ்ட் இது வந்து தேர்ட் டச் பாயிண்ட், பேஷண்ட் டச் பாயிண்ட். ஃபோர்த் டச் பாயிண்ட், patient will go to services. Doctor can prescribe medicines, radiology services, pathology services, whatever it is, they have to go there. அங்க போகும்போது அந்த ஆர்டர்ஸ்லாம் வந்து ரெடியா இருக்கணும். கரெக்டுங்களா? நாம அங்க போயிட்டு உங்களுக்கு என்ன டாக்டர் கொடுத்துருக்காங்க அந்த பேஷண்ட் லிஸ்ட் கொடுங்கலாம் கேட்கக்கூடாது. ஆர்டர் ஷுட் பி அவைலபிள் இன் ஃப்ரண்ட் ஆஃப் யுவர் சிஸ்டம். அந்த ஆர்டரை நாம ஃபில் பண்ணணும். அதுக்கு எஸ்எல்எம் இருக்காங்க. எஸ்எல்எம் தே வில் ஹெல்ப் அஸ், ஹெல்ப் த பேஷண்ட்ஸ். அந்த ப்ராசஸ் எப்படி பண்றது அதை நாங்கள் பண்ணி வச்சிருக்கோம். ஸோ அதுவும் நம்ம இங்கே ரோல் அவுட் பண்ணணும். இப்போ டாக்ஸ் பண்ணாலும் அதை நம்மளால பண்ண முடியல. நெக்ஸ்ட் பார்த்தீங்கன்னா இதெல்லாம் முடிச்சதுக்கு அப்புறமா பேஷண்ட் வெளில போறாங்க அப்படின்னா அவங்க கிட்ட ஒரே ஒரு பேப்பர் தான் இருக்கும், ரிப்போர்ட் ஷீட் இருக்கும், அவ்வளோதான். டிஜிட்டலாக ஏதாவது கொடுக்குறோமா இன்னைக்கு தேதிக்கு? எதுவுமே கிடையாது. ஹவு வி கேன் டிஜிட்டலைஸ்ட், அதுக்கு தான் நம்ம என்ன பண்ணியிருக்கோம்னா வி ஆர் கிரியேட்டிங் அ மொபைல் ஆப். அந்த மொபைல் ஆப்பில் தே கேன் சி த என்டையர் ரெசிப்ட் ஆஃப் தேர், அப்புறமா அவங்களுடைய ஓபி ஷீட்ஸ், அப்புறமா ரிப்போர்ட்ஸ், ரேடியாலஜி ரிப்போர்ட்ஸ், பேத்தாலஜி ரிப்போர்ட்ஸ், இது எல்லாத்தையுமே பார்க்கறதுக்கு ஃபுல் டீட்டெயில்ஸ் நம்ம கொடுத்துட்றோம். அது மட்டும் இல்லாமல் நாளைக்கு தே கேன் ஏபிள் டு கனெக்ட் வித் த டாக்டர்ஸ் த்ரூ வீடியோ கன்சல்டேஷன்ஸ். அதற்கான ப்ரொவிஷன்ஸும் நம்ம அது கொடுத்துருக்கோம். ஸோ அதுவும் வந்து நம்ம இங்கே பண்ணணும். அப்பார்ட் ஃப்ரம் கம்ப்யூட்டரில் வந்து நாங்கள் நெட்வொர்க் கேபிள் கனெக்ட் பண்ணுறோம், கம்ப்யூட்டர் வந்து பண்ணுறோம், அது பண்ணுறோம், இது பண்ணுறோம், இதெல்லாம் வந்துட்டு ஐடியோட பார்ட்டாக இருந்தாலுமே how we are contributing to the business, how we are contributing to the patients, how we are contributing to the doctors, how we are contributing to the nurses is very important. அதை தான் வந்து இன்னைக்கு வந்து நாங்கள் வந்து உங்களுக்கு சொன்னோம். பட் ஐ திங்க் இட் கேன் பி மோர் பெட்டர் வே தட் வி கேன் எக்ஸ்பிளைன். பிகாஸ் மேடம் சொன்ன மாதிரி நாங்கள் பிளான் பண்ணவர் வந்துட்டு இன்னைக்கு திடீர்னு சிக்காகி விழுந்ததுனால, ஸோ இம்மிடியட்டாக பண்ணதுனால எங்களால் முடிஞ்சது ஏதோ பண்ணியிருக்கோம். ஸோ நெக்ஸ்ட் வந்து ப்ராசஸ் வந்து இதில் ஏதாவது டவுட்ஸ் இருக்குன்னா ஏதாவது கேளுங்க, அதுக்கு நான் ஆன்சர் பண்ணுறேன். ஏதாவது டவுட்ஸ் இருக்கா, ஏதோ உங்களுக்கு ஏதாவது ஐடியில் வேறு ஏதாவது ப்ராப்ளம் இருக்குன்னா கூட நீங்கள் சொல்லலாம். அதாவது மேஜர் ப்ராப்ளமாக இருக்கணும், சும்மா சின்ன சின்ன ப்ராப்ளம்லாம் வேண்டாம். நான் எல்லாருடைய டைமை வேஸ்ட் பண்ண விரும்பலை. ஸோ எனி ஐடி சேலஞ்சஸ், ஐ மீன் இதை நான் பண்ணீங்கன்னா பேஷண்ட் எக்ஸ்பீரியன்ஸ் இம்ப்ரூவ் ஆகும் அப்படிங்கிற மாதிரி யாராவது எனக்கு சொன்னால் கூட ஐ எம் ஓகே.
See, recently I was in Asian Institute Gastroenterology. Adula kiosk irukku. There's a lady speaking, a chatbot. She asked, "What is your name?" and all that. After that, she said, "What is your complaint?" I say headache. She says, "Do you have a problem with your eyes? Do you have problem with your throat? Do you have sinusitis?" She'll decide which is the doctor. It comes, these many doctors are available, which doctor would you choose? I would suggest this doctor, it will say. This doctor is free between 2 to 3. This doctor is a thing speaking, one nice lady, Indian looking lady. And says your appointment is fixed. I mean, what is that system and how far are we from that?
Okay, very good question, doctor. Thank you so much. So currently, this is about a AI technology that you are bringing up on the table. So for an example, if the AI technology is required, two things. One is that we need to provide the proper schedule of doctors, first of all. Okay, that master should be cleaned. And number two is the algorithm, what we are going to give the algorithm to the AI. AI will not do anything, from her own, it will not do anything. Its own, it will not do anything. It will work based on our algorithm, what we are going to input. So this is how it is working. That use case, what you are saying is currently that we are working on it, but not that much of, kind
She
of.
speaks 14 languages.
That kind of languages and all, we have not done it. We have just started the AI, platform, that it is under testing and under development, I can say it. Maybe in another 6 months or down the line, 1 year, we can see that, in our applications should be available in our hospital.
The second thing, about 2-3 years back, I was in Madurai in a conference in Meenakshi Mission Hospital, and two of my friends, colleagues, were sitting next to each other. One is from Asian Institute Gastroenterology, the other from KIMS Hyderabad. This gentleman is doing rounds on his iPad. Patient to patient, he knows what is the urine output, what is the blood pressure, and he's typing out his orders. Same this person was doing is, I have done my rounds. I mean, can I do that?
That's what I told you, like we are behind that, we are not in for that, like we are not matching that kind of level. We just started the implementation of EMR here.
Why aren't we that level?
That's what I'm saying, we are just started the EMR here. We have not at all go that level. First we are starting the EMR with the Augmented Voice and Text license. Based on the outcome, we can able to generate multiple use cases and multiple, applications that we can develop it. First core is we should centralize and we should digitalize all our things. Currently, which we don't have it, we are having everything on paper, which we need to develop as in a digitalized format. The first cut that we need to ready with the ground, we are preparing the ground first. This is how we are doing it.
Yeah, on last question.
Please.
In 2016, I went to the UK to study the day surgery hospital pattern. 2016. They have many patients, and each patient had a trolley with a laptop. The sister is only typing into the laptop. There's nothing written, that is one thing. And second thing is the chief of anesthesia there was in a room, a nice big room, multiple monitors he has. So he is in charge of 3 hospitals. He knows which theatre is occupied, which theatre is free, how many patients are waiting 10 years ago. And he sits in his room, he monitors. He says, shift this patient to this OT, that patient, that OT, this is. And he also knows what percentage of the utility, when the time is utilized and so on. So are we anywhere near there?
Yeah. So we have developed one more, new application which is called EICU solutions, which means like it is a central monitoring unit where you can put your doctors as in a hub locations in one location, and you can able to see multiple location other ICUs. You can monitor the bedside monitor 7 parameters that you can able to monitor it. And we have created our own video consultation platform where you can discuss with the people who is sitting in front of patients, and you can start the medications. This is called EICU solution. The same pattern that we are working with e-ambulance also. While see most of the ambulance people while coming onto the on the road, there may be a possibility of losing the patients because of we can't able to provide proper medications. So avoid that. What we are doing the same thing, we are proposing this for ambulance also, that we want to monitor the patient vitals 7 parameters, and also we want to monitor the syringe pumps and infusion pumps, and also we want to monitor the patients, right? Video platform that we are built it. So that it's almost completed. Another couple of months you can see it in the rollouts in Malar also will do it. That e-ambulance we will do it, in EICU it's already ready, that we will roll out.
HC is behind, Malar is far behind.
We are the stepchild.
No, so because I am in HC, I want to roll out first in small things in HC. If it is rolled success, then I will replicate to other teams. And hereafter, what I am going to do, I am going to do the testing in Malar, and then I will replicate to others. But எனக்கு உங்களுடைய help support வேணும். Any other questions, please?
So as usual, Dr. Radhakrishna always thinks big, and I look at small things. Currently, I was horrified. I mean, we have been in the so-called corporate or network thing since 2008. So your predecessor was Fortis. They also had their own. We were nowhere near paperless or anything. Nothing. At least you have been able to successfully roll out this doc thing. Even that they could not do because the doctors did not cooperate. I think after COVID, mentally a lot of people have changed, so that has helped. So I was, what you were saying, no, every 45 days, sometimes even every month it will ask me to change the password, and I can never remember all that. But now in Malar, I am horrified that there is a common username for every desktop that is in the hospital, and there is a common password which is stuck there. I mean, it breaks all the rules that you have mentioned there. There is no role assignment, there is no data privacy. Anyone can, just a very trivial thing I'm saying, somebody who doesn't like me can send a nasty mail from my email account to anyone. That is, why are we doing that? Which is not difficult, right? At least each system can have its own username and password, at least that much. Even in the OT during Fortis, different nurses on different shifts could still log in with their, system is same, but they could log in with their individual ID. So you know that which nurse did that. Like suppose medication is ordered and some, for example, some wrong medicine or some wrong dose got indented in the drop down menu. Whereas here, this particular nurse only logged in and ordered the medicine, then you know that who did it at least. So on the level, then why have we gone back 15 years? That is my worry.
நீங்க சொன்ன அதே இதுதான் comfortable. Okay, so if I want to restrict something else, there should be a lot of noise from the other team members. For an example, I put a restriction in HC. What I have done is I have stopped the WhatsApp access. That's it. There are 100 plus calls I received from all the team members, not only from doctors. All the team members, I want this. Why? I want to copy and paste to the doctors. Why can't you use the Teams? So there were a lot of practical challenges that we are difficult. It is very difficult. Whenever we are disconnecting something, it will be difficult for all the users. But it should be formalized, and we need to do this and accept this. Change is common for all entire things. Change is common, that we need to change sometimes. Number one. And number two, as you said, we are also brought that 45 days password policy logic in HC, and we are going to roll out this in another couple of days. We almost completed, we tested and everything is ready. In another couple of days, you will see each and every 45 days, you will get prompted by the system saying that you need to change the password, number one. And number two, your local password will be removed and it will be changed. That process is already started. And number three is, we are not going to come to your location and do the, the changes or any other applications, changes. If we want to do it in desktop, we will not do it. We will do it everything on remote. That process also we have started. அது இருந்தது இப்ப இல்ல. So the old pattern எல்லாமே வந்துட்டு we are brought back again and again, one by one it will come. நான் ஏதாவது புதுசா போடும்போது there should be a problem. If any problem, please reach out to me. If the justification is legitimate, then definitely we will do the needful. Yes, on பண்ணிக்கீங்களா?
They don't get the SMS, doesn't go to the doctors. Usually because nurse is very busy. Sometimes she may forget, she may try to call, maybe engage. Same happens transfer out also. When the patient is transferred out, it's not shown there. So again, because the problem of indenting and all. This one. Second question is regarding inventory management. Nurses literally go through counting everything every shift. It takes more than 25 to half an hour. Every drug, every machine, everything. Can something be done with like image strip like RFID or something, where the inventory automatically counted and you come to know what is less?
Okay. And we talked about this with Sujata regarding the ward billing automations and
Inventory management.
I'm saying ward billing management, and as well as the inventory management also. We had a discussion with Yuvendra and as well as Sujata. There is some talks going over there. So I'll let you know what was the final decision. Based on the final decision, we will roll out. We are capable to roll out and we can able to roll out that first.
Regarding the SMS going to the doctors, when the patients come.
2 days before I received an email from Mr. Sukumar regarding this. We are working on it. We will fix it.
Also one small thing, I went for assessment in hospital. They got all education in the QR code. Like patients come to OPD, the gynae doctor would have put all the education regarding antenatal care in the QR code. You can scan and get the information. So can we think of this in future?
Definitely yes, we can.
One silly thing, the previous hospital where I was working, my personal internet whatever used to be very, very strong. Here is extremely weak. I can't go from, if something I have to click, it doesn't go forward. Only the screen shows. Why is it so poor here?
Okay.
You need to ask that.
Okay, so technically if I am speaking, we have low bandwidth. So we need to increase the bandwidth. We are providing certain connection to the patients also for the Wi-Fi connections for their usage and all. And yeah, and of course, you can answer.
Yeah. So what we are having in the, it's not a dedicated for our usage. So it's under sharing. So patient also using, ours also using. So we are planning to procure for budgeting this year for separate connections. So that would be addressed.
I can't do any academic work inside the hospital.
Yeah.
Anything academic I had to do, I had to go back home. My home is the strongest, fastest actually. I think the whole city can use it, that speed. There only I can do. I know I have certain things to do and I have a presentation. I'm going to the hospital, I can't use. That. Yeah, no, but whatever. I'm surprised because my previous hospital had a very strong connection. This hospital, and I keep thinking, this hospital is poor, so can't provide.
Dr. Vasan. Yes, sir. I don't know if it's been covered. I joined in between, sorry. From my specialty, I'm a psychiatrist. So my specialty, the most important thing would be confidentiality. Ma'am was saying, when we were there in Fortis and there was a lot of paperwork. So that time it was easier for me to, there are a lot of histories which I cannot and I should not reveal it outside, or it cannot be accessible. With DocSpad that we are using, anybody, any person, all through the hospital, he just needs to touch and everything is bang open. How are we going to protect it? Because it is not fair for, so even if you look at drug abuse, the list of drugs that he's been taking, that cannot be revealed to everywhere outside. So now with this, I'm forced not to write it. And it becomes a headache for me because I have to keep it in mind, what is that which I have not written, and maintain a separate logbook or write separate. So it's not making it easier. If this privacy or confidentiality, if you could address it, that access is restricted to me or only to the doctors or only to the MS, that would be wonderful.
Super. Doctor, actually, we have talked about this. I mean, it is not a correct, correct way that we are opening to in the entire history to the patients. I mean, some other people who are seeing everything you can see by anybody. So what we are preferring is, we have a EMR, great EMR in cranium. Why can't we use a cranium EMR with voice to text, Agnito license? That's what we are bringing on table. We will, I will inform to Sukumar that I will give you one EMR to you. Okay, for an example, I'm saying to you, just try that, and you should do the ordering of prescription, and you should do the ordering of pathology and radiology services. Definitely, it will be very easy than DocSpad, that you will feel the difference. Just try for 2 days, and whatever you are asking, the restrictions, everything is available in the cranium.
If it is, then it is.
Absolutely, yes.
Making it difficult. I am not able to, it is, I have to write in DocSpad what can be visible to everybody. Maintain a separate record which only I should know, because if he comes after 3 months, I might not know the history and what drug is contraindicated for him. So it is making it even more difficult. Like the previous last 10 years, it was a little easier for me in the sense, it was always maintained separately and I had to just go and open the book, see that page, and I would know the history for myself.
I would like to ask from each and every doctors whether this DocSpad is easy to use or something else you want to do in a different way like that. It's a separate discussion that we will have a discussion separately, doctor.
Thank you.
Does anyone else have any questions? Because otherwise we'll go for the role play.
Any questions?
Any questions? யாருக்குமே ஐடி சம்பந்தமா டவுட்டே இல்லையா? அப்புறம் நாளைக்கு ஃபோன் போக கூடாது.
So other countries use systems like Epic, right? Have we considered implementing that? Because if doctors who work here end up going there, it becomes an easier transition for them from going from paper to Epic systems and all that type of stuff.
Epic is just an example of.
Yes, ma'am. That's what just.
So
Yeah.
In each country, each place, in US itself, they have so many things. So I think we have to develop our own thing and use our things made in India and costing 1/10 of what it will cost. So yeah, we will all get trained in using electronic health records so that we can transition to any other EHR format wherever we go. Every part
It's again a compliance point of view that we are talking about. It's again a compliance point of view. As far as in India, so we are looking for HIPAA compliance and GDPR, data security, DPDP also. And talk about the ISO standards and everything, it will comes under that. My suggestion is, EPIC is one of the EHR that you are talking about, but my suggestion is let us try with that cranium, whatever it is available currently, then we will definitely look forward that.
I have one more doubt.
Yes.
Regarding reorder levels of drugs. Though I'm not connected directly with that, but we also have the impact. The pharmacy cannot know like when is the condition is supposed to order the drug. For example, particular drug gets over, it comes to 50, the automatic indent goes. But it is not there because we don't come to know when the drug is getting over. There are a lot of not available drugs.
21st, that is tomorrow.
Yeah.
We are going to put one more build in cranium that will be available in UAT, not on live. The ROL what you are talking about is already targeted, and it will be implemented in UAT. Okay, UAT environment by tomorrow. If it is success, we will move the live on before first. That's what we are doing it. What ROL is already available. Any other questions, or can we move to role play?
Yes, I think we should. We don't have time.
Yes.
So now they are going to show demo of two scenarios. One is how they are going to manually do all the things, and after that how they are gonna do in our cranium.
Sir, 2 days உடம்பு இல்லை சார் டாக்டர் பார்க்கணும். என்ன கம்ப்ளைண்ட் சார்?
2-3 டேஸாக கோல்ட் ஃபீவராக இருக்குது.
ஹாஸ்பிட்டலுக்கு ஆல்ரெடி நீங்கள் வந்திருக்கீங்களா? இதுதான் ஃபர்ஸ்ட் டைமா?
இதான் ஃபர்ஸ்ட் டைம்.
இந்த ஃபார்ம் மட்டும் ஃபில் பண்ணுங்க.
சரி.
சார் லேட் ஆகும் சார், டாக்டர் பார்க்கணும். சார் வண்டியே வந்துடும் சார், இவ்வளோ லேட்டாக வந்தீங்கன்னா.
குட் மார்னிங் சார், என் பேர் தரணி, நான் ஓபிடி ஸ்டாஃபு. உங்களுக்கு பிபி வெயிட்லாம் செக் பண்ணிவிட்டு டாக்டர் பார்க்க அனுப்புகிறேன். இன்னும் எவ்வளோ நேரமாக ஆகும்? அவங்க டாக்டர் பார்க்க போகலாம்.
மார்னிங் சார், உட்காருங்க. என்ன பிரச்சனை?
சார் 2 டேஸாக ஃபீவராக இருக்குது சார். ஒரு ஃபீவரிஷாகவும் ஒரு மாதிரி கோல்டிஷாகவும் இருக்குது சார்.
இருமல் சளி ஏதாச்சும் இருக்கா?
இருக்குது சார்.
இது சளியில் ஏதாச்சும் ரத்தம் அந்த மாதிரி எதுவும் இல்லைல்ல? ஜுரம் எப்போல்லாம் வருது? காலையில் வருதா நைட்டில் வருதா?
நைட்டில் தான் சார் வருது.
நைட்டில் தானா? இது பகல்லலாம் பரவாயில்ல?
பகலெல்லாம் பரவாயில்ல சார்.
ஓகே, ஒரு நிமிஷம். நம்ம ஸ்டெத்தை வச்சு கேட்டுப்பா. மூச்சுடுங்க. கேட்டதுல கொஞ்சம் குறகுறன்னு கேட்குதுங்க. பிளட் டெஸ்ட் எல்லாம் எடுத்தாச்சா? இந்த பிளட் டெஸ்ட் எல்லாம் எடுத்திருக்கீங்களா? அது ரிப்போர்ட்டை மட்டும் காமிங்க
சார்.
ரிப்போர்ட்டை வீட்டில் வச்சுட்டிங்களா? அது பார்த்து தானே நான் வந்து மருந்து கொடுக்க முடியும். அது என்ன கிருமி என்னன்னு பார்த்து தான் அதுக்கு அப்ரோப்ரியேட்டாக ட்ரீட்மெண்ட் கொடுக்க முடியும். சரி, இப்போதைக்கு நான் வந்து அந்த டெஸ்ட்டு திருப்பி எழுதி தரேன். நீங்கள் அதை திருப்பி எடுக்கிறதுனால எடுத்துக்கலாம், இல்லைனா அந்த ரிப்போர்ட்டோட வந்து காமிங்க. சரியா? அது வரைக்கும் நான் வந்து ஐ கேனாட் கிவ் புதுசாக. இப்போதைக்கு இந்த சளிக்காண்டி நான் எழுதி தரேன். ஆனால் கரெக்டான ட்ரீட்மெண்ட்டுக்கு அந்த ரிப்போர்ட்டை பார்த்து தான் நம்ம கொடுக்க முடியும். ஓகே?
So they did all the things in manually only. Then report also manual only. So now they are going to do registration as well. OP visit they are going to generate in our cranium. After that doctors login going to EMR, how they are going to enter or hold the assessment. After that respective department, if they are raising CBC for example, it will goes to our lab module. If it is a radiology, it will goes to our radiology module. It is integrated with our PACS medicine optic, like that cardiology, EEG, everything. Then they can able to view all the past records in their visit notes, who are all the doctor, the past visit they visit, and all the records are there in the print, as well the prescription, as well the lab radiology, every reports. They are going to do the demo lab. Okay.
சொல்லுங்கள் சார். சார் உடம்பு சரியில்லை, டாக்டர் பார்க்கணும் சார்.
சார் நம்பர் சொல்லுங்கள், மொபைல் நம்பர் சொல்லுங்கள்.
63
சொல்லுங்கள். 63 ஓகே
74. Then last number will be changed sir.
74
24 05 81.
சார் உங்கள் நேம் மெல்கினா? மிஸ்டர் மெல்கின்
சார். ஆமாம் சார்.
ஓகே, just take the vitals and see the doctor sir.
ஓகே சார்.
குட் மார்னிங் சார். உட்காருங்க சார்.
After saving only, doctor can able to view in their module. Now they are going to give call doctor. Now doctor can able to view the doctor's outpatient list.
சார் உங்கள் பேர்?
மெல்கின் சார்.
ஓகே, சரிங்க. இப்போ என்ன தொந்தரவுக்காண்டி வந்திருக்கீங்க?
ஃபீவர் தான் சார்.
அப்படியா?
ஓகே.
எத்தனை நாள் ஃபீவர் இருக்குங்க?
ஃபர்ஸ்ட் 2 டேஸாக இருக்குது சார்.
அப்படியா? 2 டேஸா?
ஆமாம் சார்.
ஓகே. இருமல் சளி ஏதாச்சும் வருதா?
இருக்குது சார்.
ஓகே ஓகே. அது சளி வந்து எப்போ ஃபீவர் வந்து ஈவினிங் தான் இருக்கா, இல்லை காலையிலையும், இல்லை பகல் பூரா இருக்கா?
So it is empty text box only sir, comment box like that only. Drop downs will come under investigation like prescription and all drop downs there.
Once voice to text comes, it may not matter.
சரி, ஈவினிங் தான் ஃபீவர் இருக்கா?
ஈவினிங் தான் சார்.
இது பிளட் டெஸ்ட்லாம் எடுத்தாச்சாங்க?
எடுத்தாங்க சார்.
எடுத்துட்டாங்களா?
எடுத்தாங்க சார்.
and doctor recommendation field is the mandatory one. We have to, and 5 more fields we are going to make as a mandatory, like diagnosis, doctor notes, that and all. That also for the literature.
Oh.
Or should we put the allergy so that we can see whether it pops while prescribing?
Okay.
Brufen போட்டுருக்கேன் அப்பனா அது prescribe பண்றது brufen எதுனா whether it allows.
So the doctor is only working on the computer, not talking to the patient.
That is why we are telling like cognito will be more useful.
Okay. So நீங்கள் blood test எடுத்துக்கீங்களா?
Yes sir.
Okay.
So this clinical history box is mandatory. Without this will reflect in our laboratory clinical notes. So this field is mandatory for all the investigation if you are raising here. Yeah, yeah.
சரிங்க, இது பிளட் டெஸ்ட் வந்து ஒன்று பெண்டிங் இருக்கு, அது மட்டும் பண்ணிடலாம். சரியா? மற்ற பிளட் டெஸ்ட் ரிப்போர்ட்ஸ்லாம் இதில் வந்திருக்கு.
ஓகே சார்.
ஸோ அது எது அதில் பார்த்ததுல இது இந்த கேள்வி தான் வந்திருக்கு. அது வந்து நான் எழுதி தரேன்.
ஓகே சார்.
இந்த ரிப்போர்ட் மட்டும் வந்துட்டு எப்படின்னு பார்க்கலாம். ஒரு 3 நாளில் மாத்திரை வந்து ஒரு 5 நாளுக்கு போடுங்க.
ஓகே.
3 நாளில் வந்து பிளட் டெஸ்ட் எடுத்து பார்த்துட்டு எப்படி இருக்குன்னு பார்க்கலாம்.
ஓகே.
ஓகே சரி.
So here you can add the prescription, and if it is the same patient, you are going to give a same medication or 5 medications same கொடுக்க போறீங்கன்னா, you can enter as a favorite medication column is there. Scroll. So favorite medications you can able to add a bunch of medications. நான் இதுதான் நார்மலா இந்த மாதிரி ஃபீவரா வந்தா கொடுப்பேன். லைக் நீங்க favorite medicationல போட்டுக்கலாம். And current prescription after rise the prescription ஏதாவது edit பண்ணனும்னா you can able to go and enter whatever the things you can edit. Yeah. Then now I will show the result.
The brand name is also necessary.
Yeah.
What was the prescription?
Yeah, anything you can buy, your prescription.
Okay. You can type the generic and whatever is
No,
available here.
brand itself like this, sir. Brand is that drop down will come, sir. If you are choosing one paracetamol 500.
I think we all go to HC join there.
So it is available in our location also. It is there. So that is what we are trying to say. Dogs per instead of dogs per.
We are using dogs.
I don't know who to ask.
So if you write, so like this it will come. And this overall dosage quantity and all we can able to map. 1 minute. 1 minute, sir. Refresh. Just change this.
IPSC plus போடுங்க brand name. Let's see how smart it is.
Just type brand name. Brand name. Just no problem. You can raise. Yeah. So the drop down will come, sir, like that. No, this thing I will add and give, sir. Our pharmacy inventory only. This is in a testing server. So limited of inventory only here. So what are the things in live? It is more.
Once I have told patient is allergic to brufen, it should not allow me to prescribe immediately.
That is a separate thing, ma'am. That antibiotic restriction like that you are telling no. That allergies, no. Medicines. No, it will have. That star is a mandatory one. No, it will not alert, ma'am. As of now, it is not there. As of now, it is not there. It will not alert any if you are raising any allergy medication. For okay. So I will show you the report here. The patient, there is no report for this patient. I will show mine. You can able to see the patient's history like this. This patient seen in the doctors, and a different visit number will be there. You can able to see like this, and just click encounter summary, and if any result is there now, it will list like this. So if you click final, that report will generate, and you can take print and give to the patient. Like that for radiology, and like that for EMR I will show. This is for lab, and visit notes, patient EMR plus prescription will come. Like if any prescription entered by doctor, it will come like. That's it. It's improve patient experience. Thank you, sir.
But a big hand to the IT team has come all the way.
My brother is a big shot software technology guy. He runs his own company and all. So he was invited by his university to come and give a lecture in a top university in the US. But when he started his presentation and he clicked on something, it didn't open. So IT people பண்றச்சியே IT பிரச்சனை பண்ணுங்கிறது இன்னைக்கு first time in the history of Karkandhu we have overshot time. So just blame it on technology. Okay, so we'll do the quiz quickly, and then we'll all head back to work. Just apologize to the people whom you are supposed to relieve once you go today. From next time, we'll make sure that we'll finish on time.
Okay. Thank you so much, the entire IT team. Melkin is a lovely chap. He's there for every one of our meetings, and he takes care of the computer. Only the sound is taken care by security. Yeah, but I don't know why IT people don't take care of sound. I don't know. But anyway, thank you so much, and I'll do the routine quiz. There are 10 questions, and when it came to IT, I didn't know how to make questions. Bear with me. Can I have some lights off? Okay, prize is ready. Vidya, you need to keep an eye. So who's going to lift the hand to say? Okay. You all should understand that if we are not IT savvy, we are not there in medicine. So actually there are only doctors who know how to, or other healthcare personnel who know how to deal with IT are only ones who are going to progress in life. The others will not. So make sure that you learn something or the other about IT every single day. Question. This logo belongs to which? Yeah. The yellow one. Yeah, microphone to her. What is it?
Carotline.
What is it?
Jewelry. It's a jewelry shop.
You're prompting. She wanted this to happen very quickly, so no prompting, please. That's a correct answer. The IT head will give the prize to. Okay, the Catalan belongs to which company? Is a Tanishq partnership, Tata. I think she goes every once in a week to looks like. Actually, this Catalan is something with online jewelry sale, not going. Your associate is also nodding. Theatre people have a lot of money. Okay, next question. Raise your hand, please. That's the correct answer. No. But you could have got it then. Why didn't you say? Umani Bangar Chetty is the right answer. And last time, when did you go to Umani Bangar Chetty? போகலாம் எப்படி கண்டுபிடிச்சிங்க? இல்லை பட் நான் உங்களுக்கே தெரியல அது. See, this is the 4th generation Umidiyar. They are running this Two young men with their wives, no, this is the latest. Their father is alive, that is the third generation. Ummadi Bangaru Chetty Jewelers. Okay, next question. Get ready, please. I think Anita has raised her hand. Yeah, what is it? Yeah. Tanishq, what does it sell? Jewelry. Okay, that's the right answer. Please come. Pass the gift on. Tanishq. Okay, before giving the gift, no, wait. You should tell what does Tanishq mean. Anyone? Okay, you can take the prize. Tanishq is Tan-ishq. Tan is body, ishq is love. Okay, you love your body. Do you? That is Tanishq. Next question. That is Tanishq Tata product. Okay. Raise your hand. This logo belongs to which organization, brand, or product? Melkin seems to know. I think he's gone with his girlfriend there. Or girlfriends. Anyone? What logo is this? Malabar. Malabar is not the right answer. Anyone? Vignesh? You haven't taken your wife here? Or neighbor's wife at least? Okay. How is that you don't know Joy Alucas? Very, very sad. See, how Joy Alucas name gets Joy Alucas is because of this gentleman. You know, that is a book about his biography. It says Spreading Joy. He's from Kerala. Okay. This logo belongs to which organization? CNN seems to know. Anyone? தெரியல யாருமே தெரியலையே. See, I went to Trivandrum and went to some special place and we're discussing Trivandrum the largest Lulu Mall. Chennai Lulu Mall, they're building somewhere near Coimbatore. Who says that? Milka. Yeah, okay. She going to give consolation prize to you for that information. Yeah. நீ டெய்லி போய் பாக்குறீங்களா இப்ப எவ்வளவு தூரம் வந்திருக்குன்னு? Lulu Mall is the right answer. Next question. Of course, you know the name of this gentleman who owns the Lulu Mall? Anyone? Anyone? How is that you don't know the name? M.A. Yusuf Ali from a place called Natika in Kerala. There's one Lulu Mall in Lucknow also. Right, we'll move on. Yeah. Anyway, I think Swarna will put her hand up first. Yeah, Swarna, get up. What is? Correct. That's the right answer. But why is there a peacock in Chennai silk? Why not a pig? Chennai pig இல்லையா? நேஷனல் வேறு சென்னைக்கு என்ன சம்பந்தம்? அது நேஷனல் தான் சென்னை போட மாட்டான். Anyway, Google and find. Just see, life is not just medicine. Life is just not nursing. Life has got so many interesting things. You have to just see why things are named in a particular way. You know, it's very interesting. Again, she put her hand up. She got a prize already. Who said Raymond? You also got a prize. Where are you? Okay. Why is it called Raymond?
The owner is Mr. Raymond.
Which country does he belong to?
Chennai.
No. The owner is not Raymond, by the way.
Because Swarna already got a prize in Sunita.
Okay, Sunita. Raymond's. Come, collect your prize. I told them the quiz will be loaded after you come here, so they will not know anything about it. See, the Raymond's started in 1900, and the engineer who built that, it is Singhania group actually, who built the factory is Raymond. They named him after him, and the Raymond, the name caught on, so they didn't want to change to Singhania. Even though Singhania hold, but Raymond is the thing. Raymond is not a Chennai, by the way. Is he a neighbor? Okay, that's a Raymond shop. Oh, you read Bengal? I didn't know what language is that, Vidya. She should get a prize for that. Yes, in Bengali it's written there, Raymond shop. Yeah. Hey, come on, that's a correct answer. Everyone there. இல்ல எப்படி தெரியும் உங்களுக்கு? ஓனர்? ஓனர் ஃபேமிலி ஃப்ரெண்டா? So for you everything is free. இல்ல why is that? என்னது? What is it? அது ஒரு பூவா இல்ல ஒரு வேலா என்னது? வேல் மாதிரியா இருக்கு, அது என்ன கோட் அப்படி SS மாதிரி? Oh, Saravana Stores is SS, right. But அதோட லோகோ மாறிடுச்சு, இப்போ இதுதான் லோகோ. IT chap is very knowledgeable there. Really. Wonderful. Okay. Yeah. New Balance is the correct answer. It's not Nike. Nike design wear. This is New Balance. Is there a New Balance showroom in Chennai? அது இருக்கு, எங்களுக்கு தெரியும். ஸ்டோர் இருக்கா இல்லையா? ஸ்டோர் இல்ல. I saw a New Balance showroom in New Zealand. I saw in Brazil, but India doesn't. But that's a very good shoe. I have New Balance. Anyone else? You did? Okay, I think the next one may be the last question. I don't know. Yes. This logo belongs to which organization, brand, or picture? Yeah. BI, yeah. FBI, no. Anybody else? RBI, no. Any other guess? It's a government of one particular state. Who said Pondicherry? That's the correct answer. Yeah, come. Okay, you pass it on. Thank you so much. I hope you enjoyed the IT session. Thank you.